Hi, welcome back for another one of our YouTube episodes about nurse practitioners and PAs. We call them APPs, Advanced Practice Providers. I hope you've had a chance to look at some of our other videos. I'm at the University of Miami. My name is Mike Wang. I'm a professor of neurosurgery here. We're doing this in collaboration with the AANS, which is the AANS, or American Association of Neurological Surgeons. So today we're very lucky to be joined by Cathy Rosenberg. Cathy has been with our department how many years now, Cathy?
24 years.
24 years. And she was our second APP, nurse practitioner, if you will, and helped to build this impressive program we have here at University of Miami. You also have a teaching role in the nursing school, correct?
Not officially at the School of Nursing, but I have a clinical instructor role with the division. But I have taught at the nursing school in the past, and I have an active education role with the nurses in the hospital. Great.
Now, Cathy has been a mentor to so many nurses and APPs over the years. It's really amazing. She's been sort of like the inspirational head of that part of our department, and now the hospital. So, Cathy, your current role is as, describe it to us, if you will.
So I'm the Associate Vice President for Neurosurgery and Orthopedics. That's the administrative aspect of my role. I continue to have some clinical practice in the Division of Neurosurgery. I also oversee the Department of Orthopedics on the inpatient division, and I oversee a large number of inpatient nurse practitioners on the surgical service lines and in the intensive care units.
Right, and to clarify, that's for the University of Miami Hospital, which is where we are right now. And you know, neurosurgery and orthopedics, those are two of the most profitable service lines in any major hospital, so that's a very, very heavy lift, if you will. And Cathy, you've been doing this how long?
In this current role, it's 6 years. And in the nurse practitioner role for neurosurgery, it's been 24 years.
Wow, 24 years, that's great. I do want to get to the main topic of today, which is to talk about APPs in leadership and in administration, which I think you've had so much experience in. But before we get there, why don't we kind of dial it back and tell us a little about how you started as a nurse and how you came to become a nurse practitioner.
Okay. So I started as an RN in the ICU at the University of, at Maine Medical Center in Portland, Maine. I was fortunate to be a new graduate in critical care and one of 6 people that started in a new training program. So I was very fortunate to grow up in a multidisciplinary ICU with incredible mentors and experienced RNs, and had a very lengthy mentorship program there that was at least 6 to 12 months. So I worked there for a couple of years and then ultimately moved to Miami. And I was an ICU nurse in Miami for, I think, about 11 years in total. I was an RN. I became a critical care clinician where I took on responsibilities for education, where I learned more about long-term management about patients and the impact of finances on length of stay and finances. And ultimately went back to school during that time and went back to the bedside.
So you've done so many things here in of course, from your clinical role and your mentorship role, but again, we're going to speak today about the sort of administrative management piece. And I know you've led quality improvement programs or ERAS programs here, as well as financial initiatives and all these different things. And we could take each of those little areas and spend a whole day talking about them, right? But let's talk more broadly first about what kind of value the APP brings to that role. In other words, if you're the nurse administrator or lead or vice chair or whatever you're doing, what is it that's unique about APPs that lets them fulfill that role in a special way, maybe as opposed to a physician or an MBA or an accountant, right?
Sure. No, that's actually a really good question. I think the unique perspective that an advanced practice provider brings is that we are highly patient-centric, and we remain patient-centric first through all initiatives. So I think that really helps to guide the teams that we pull together to ensure that all the professions are at the table when necessary. I think it helps us to make decisions that always benefit the patients while we're keeping things like finance and technology and the physician's preference in mind. I do think that helps us. I also think that one of the roles of the APP is you tend to have expertise in interprofessional collaboration, and so I think that that's probably the greatest part of my strength in this role, is I worked with so many of the disciplines and I have great working relationships with them. So whenever we have a new project, when I need to reach out to them, they're highly responsive and helpful to our service lines.
Now, I know that you managed to keep a leg in the clinical practice, whether coming to clinic or rounding on patients or coming to surgery and all that, but it's almost like you do that like in your spare time, and I say that jokingly because you don't have any spare time. But a lot of folks going into sort of administrative aspects, they kind of have to give up a lot of that clinical care, right? Was that tough for you?
It was difficult, and it remains difficult. I think that my clinical role is the thing that I've enjoyed the most, and it's where I get the best emotional paycheck. So part of my ongoing involvement is for selfish reasons, so that I remain, emotionally satisfied as well as professionally satisfied. Some days when I'm seeing patients, it's really around service recovery. And although that may not be directly clinical, it helps me to demonstrate the types of behaviors to our younger staff to help them through challenging circumstances. And so if we can all get to a positive place where there's a good outcome either for the patient or the family or a service line, then I think that that's a benefit for all of us.
Yeah, I certainly see you. I've seen you do that many times over the last decade and a half that I've known you. So for the nurse practitioner or PA thinking about maybe taking that leap, either putting a toe into administrative roles or some kind of a lead role. I know that Jackie, who was on here previously, is starting to do that now, and it's a transition for her. What are the things you would recommend in preparation? In other words, this isn't something that they necessarily prepare you for,
Correct.
right, in school or on the job. So what would you do to prepare if you wanted to go that way?
So I think there are different arms administratively that people can become involved in. There are quality projects that you can certainly get involved in and start to learn how things work administratively. There are financial initiatives that you can become involved in. As a new nurse working on a floor and gaining experience, you can become a charge nurse to understand how that particular role impacts flow. Nurse practitioners, for example, may start off with something as simple as scheduling and being aware of the impact that overscheduling or underscheduling has on the function of a unit. There's certainly ways where you can formally educate yourself, where you can get an MBA or you can get a master's in healthcare administration. But I don't think all of the education has to be formal. I think, and you also have to think about where your goals lie. Are they educational? Are they strictly management? Do you want it to be in mentorship? And I think you try to align yourself with the types of projects that really suit you professionally and personally. And the more you get involved, the more opportunities you have to try those roles on. And then people start to recognize your strengths and you start to get pulled more and more into those roles.
Mm-hmm. Yeah, the sheer diversity of options, as you've already described them, can be very intimidating, right? How do you do this? Do you do this organically, or do you have a concerted way of going into, I'm going to become a manager or whatnot? Now, we know a lot of folks come to that role without having become a nurse practitioner first, and some come directly out of with just a nursing degree, right, the RN. If you have the ARNP or a PA degree, if you will, do you think there's an additive advantage, or what difference is there, I guess?
To go into administration?
Correct, yes.
So I think there may be an advantage from the perspective that you have probably had more years of experience. So you come into the role with a little bit more maturity. I think that your clinical understanding is greater, which allows you to advocate not only for the patients more effectively, but also for the staff. I think being a staff advocate is a huge component of being successful, because if you can't speak to the needs of your staff for them to do their jobs effectively, no one will do well, right?
Yeah, I think that's a good point, because I think as an APP you're forced, if you will, to see multiple perspectives that maybe someone who's working as a nurse in a typical role might not see, right? That's what you're saying? Yeah, I agree with that. I think it's a wonderful thing. And are you thinking about going to business school?
I think about it periodically. I just have to figure out the time frame. You and I talk about going back for the MBA versus the Master's in Healthcare Administration. And I think my biggest consideration is at this stage in my career, what type of financial investment do I want to make for the long-term gain, and based on whatever initiatives are happening at a hospital level, how much time do I have to dedicate to a program of that magnitude. But I think if it's something that, if I were younger in my career, for example, and I knew that this was not potentially my retirement job, would I go back and get my MBA? The answer is probably a more solid yes, because I think it would make me more competitive in a market where I maybe wanted to leave the University of Miami.
Yeah, I really enjoyed this conversation. At some point, we would like to go far deeper into all these elements, say into the business side of medicine or the management side or the HR side, which I know you manage all of these aspects here for us. But I think what you've done is you've shown maybe some of the younger nurses and PAs out there that a lot of folks think that this is sort of, I don't want to say it's a dead end, but you get to the ceiling and that's it, but you can actually go far beyond that, right?
Correct. And it's really about, I think, speaking to people in your network and letting them know what your interests are. And as opportunities come up, then hopefully they tap you on the shoulder for an opportunity to participate. I know when I do my evaluations with my team, or I'm just talking with them during one-on-ones, I always like to try to pick their brain and ask what their trajectory is at that time. And then as things change in the system, I always try to think about who are the people that can help participate to make things better.
Right. Well, Cathy, I thank you for your time. We have to have you back. And I just wanted to let our audience know that on behalf of the AANS, the American Association of Neurosurgeons, we have a huge compendium of educational offerings. Please go to our website if you're interested at AANS.org and check out the links at the end of this video. Thank you.